Now, I shall go to the next class. CLL, chronic lymphocytic leukemia. Always the word chronic means mature cells are present. Acute means there is a maturation arrest. Chronic lymphocytic leukemia, it can be a disease of either the B lymphocytes or the T lymphocytes. As a result of which, though there is an increase, they are all immunologically incompetent. The patient can be prone for infections. Again, the age is increased. Chronic means older age, 50 to 75 years. There can be a lymph node enlargement. Most of the cases, it is an incidental finding. De novo it is found. Splenomegaly may be present, mediastinal pressure because of the lymph nodes. Visual disturbances. Always when something is going to compress upon the optic nerves, it can happen. Spinal cord compression leading to pain, and there can be a mild amount of hemolysis. These are the clinical features. Always try to have the clinical features in mind because your question can be a problem-based question. More common in Western countries, less in India, they say. This is the classical picture which I would like you people to kindly describe. So, in this case, I am finding that there are a lot of these cells resembling the mature lymphocytes which are increased. So, this orange arrow points to one classical cell. It is almost about the size of the RBC. But then there can be some cells which are slightly larger. Look at this blue one, arrow. This is the pro-lymphocyte, the immediate precursor of it. Also, I can see some cells which are somewhat smudged or they are called as a basket cells. I cannot make the morphology of this. RBCs are normal, platelets will be decreased. And there is a uniformity among the cells, and hence look at this picture over here, the girls wearing the school uniform, and it is described as a school girl pattern. For heaven's sake, please do not write only school girl or college girl. Please describe it completely. The blood picture is, you find that the hemoglobin will be less than 8 grams. RBCs are normocytic, normochromic. There can be a mild hemolytic anemia, autoimmune hemolytic anemia, wherein Coombs test is positive. This is very important. WBCs are increased, but not to the extent of CME. Here it can be as low as 5,000, gradually it goes to more than a lakh. 90% of the cells in this case resemble the mature lymphocytes. There can be a few pro-lymphocytes, no blasts. There can be smudge cells or smear cells or basket cells. 3 names are given for it. Platelets are reduced, serum bilirubin increased because of hemolysis, and Coombs test will be positive. Bone marrow is hypercellular because of the increase in the lymphocytes. Erythropoiesis suppressed, leukopoiesis suppressed, megakaryopoiesis is also suppressed. And lymphocytes almost resembling the picture of the peripheral blood. Mitosis will be reduced, and these are the other findings. There can be the pan B cell markers. The digits are given over here. Kindly read them out. Bone marrow biopsy can be done to, again, rule out a diffuse or a nodular infiltration. The differential diagnosis can be a lymphoma infiltrating the bone marrow. Prognosis, the disease is a slowly progressing one, and it is said that the patient dies because of the age and not of the disease. The treatment can be radiotherapy and chemotherapy. The differential diagnoses are B type of chronic lymphocytic T cell, hairy cell leukemia, and a lymphoma infiltrating the marrow, as well as spillover into the peripheral blood. Class number 25 is over.